Hello, everybody, and good evening. Thank you very much for joining the Migraine Association of Ireland this evening. As part of our Understanding My Migraine series, we'll be joined by Dr. Mary Kearney this evening to give an overview of acute treatments in migraine. Dr. Mary Kearney is a GP with an extended role in headache and migraine. In consultation with Dr. Martin Ruttledge and nurse specialist Esther Tomkins from Beaumont, she was lead author of the publication Migraine Diagnosis and Management from a GP Perspective for the ICGP. Dr. Kearney has done a lot of work for the Migraine Association before and has spoken at a lot of our events, so we are very grateful to have you with us again this evening.
Well, Si, thank you very much for that introduction. It's a great honour for me to be asked, in fact, and to discuss this very important topic yet again. And I only hope that the information we can help people with it, and that we can maybe lighten the load on migraine, because it is such a difficult time for people. As you can see, I'm involved in a few different organisations. I had my own practice in Dunlavin for more than 20 years, and an opportunity came for me to step back from full-time practice. So I took it, and I've upskilled in headaches since that time. I've no financial interest or relationship or anything to disclose with regards to the matter of this presentation, and the information is as accurate as of now. We all know that migraine is a huge problem, and anybody who suffers with it knows that it can be a really difficult problem. And the staggering thing is that 42% of all women have a migraine headache sometime in their lifetime. It's not uncommon for people to come in to me with their child and say, oh, well, Mary has migraine, but I never had migraine. But then maybe later on in the conversation, they'll say, well, I did have one migraine once. And everybody, well, a lot of people can tell you about that. The sad thing is, it is the highest cause of disability in people women in particular, at the most productive time of their lives, where they're going through education, college, joining the workforce, maybe getting married, settling down, having a family. And these are all additional stresses and terrible trouble for them. Maybe caring for elderly parents, which is really, in this time of COVID, is really such a trial if they can't do it. And as we've said before, it's a very significant burden with disability, second to back pain. And we all know how bad back pain is. And these are not just Irish figures, but international figures. So what's the best thing to do when you get a migraine? And really, it's difficult to answer that question. But it depends upon the circumstances. And I say to people, take your medication and get to bed. But that's not always possible. And then the next best thing is for the women who have a medication to hand in your car or in your handbag. But what about the child in school? And all too often we have teenagers where they're at a very vulnerable time in their life and the migraine comes and they don't want to be telling people. They finally have to go to the teacher and the parents are wrong. And where did they leave the poor child? They leave them in the middle of a busy hallway, maybe in the main hallway of the school, where there's noise and light and everything. It's just awful. So the best thing to do is go somewhere quiet and take a medication. On the other hand, I'm thinking of a school teacher I had, and what I said to her was, she was fortunate enough to be teaching remedial teachers, so she could get her pupil back to her class, she could take her medication, put her head down in the classroom, maybe just 10 or 15 minutes, and it can make all the difference. I always think if you have small children, you need to be able to phone a friend, and perhaps you can reciprocate at some stage and help out with small children too. This is the treatment, and this is taken from the migraine document that Si mentioned in the introduction. This diagram and this idea came from Dr. Martin Ruttledge and Nurse Jane Melling from the Mater Hospital. Dr. Ruttledge is in Beaumont. We've recently updated it. And, it seems a bit, gosh, what are they saying? But there's 3 different medications you can have. You can take paracetamol, You can take the non-steroidal anti-inflammatory drug, and the one that comes to mind first would be Nurofen. And then there's the triptans. Now, the paracetamol you can take too. The ibuprofen and the Nurofen are the same class of drug, but it's 600 milligrams every 8 hours. All too often, I find people don't take adequate ibuprofen in the beginning. And even naproxen, they don't take adequate naproxen. But you can take one from this column, and one from the non-steroidal column, and one from the triptan. Just a few words about triptan. Recently, I had somebody who really wasn't getting a good response to their acute treatment, and they were taking sumatriptan, 2.5 mgs, because the sumatriptan wasn't doing anything. But when I reviewed it, this lady was 100 kilos and she was still taking only 2.5 mgs. My advice to her was, take the 5 milligrams, immediately you get a headache. Thankfully, it's given her a good response and she's quite happy. So you need to take the acute medication. You need to have it to hand. It's best to take it just as the headache is starting. For those who get a migraine with an aura, you might be tempted to take it during the aura, but they say it's better to have it to hand and be ready to take it just as the headache comes on. I also want to add that you can take Motilium, an anti-sickness tablet, because it'll help the nausea, maybe hopefully prevent the vomiting, and help to get the medications absorbed more quickly, as well as all of this. And as I said, this is the document that Sai very kindly mentioned in the introduction. Initially, it was available to the public. It's now not available to the public, but it is available to all doctors who are members of the Irish College of General Practitioners, and the diagram that I mentioned about acute treatment is available in it. So how many sumatriptan or how many triptans can you take without over-medicating? And this is a really important thing to keep in mind. You really should only take them on 4 to 6 days per month. And if you're taking sumatriptan on more than 10 days or more a month, or paracetamol, the humble paracetamol on 15 or more days per month, you're considered to have medication overuse. And the other medication to consider is something like sulfidine. If you're taking that on more than 10 days per month, you're considered to have medication overuse, which unfortunately can lead to medication overuse headache. And I'm sure Dr. Martin Ruttledge will discuss this in the preventative treatments. And if you're needing painkillers on more than 4 to 6 days per month, then you need to be discussing with your doctor about preventative treatment. And definitely, if you're taking medication on more than 8 to 10 days per month, you should be definitely on medication for prevention. So a little bit of information about the triptans, because a lot of doctors are familiar with the painkillers, but they're not quite as familiar with the triptans. Unfortunately, triptans don't work for everybody. If you have a lack of response to one triptan, does not predict a lack of response to other triptans. So if you take your sumatriptan and you've taken it twice and it hasn't worked, well then it might be worth changing to a different triptan to see if it might work. And as we said earlier, they're more effective when taken early in the headache phase, but they're less likely to be effective if taken during the aura phase. So that's just a couple of things to keep in mind when you are taking triptans. Take an adequate dose, take it at the proper time, and if after trying it out twice it doesn't work, consider a change. And for those who are vomiting, you say, oh, I can't face them. There's lots of options. This one here is the nasal spray. You just take off the top, put this part here into your nose and squirt it. Now, the disadvantage is it does cause a nasty taste in your mouth, but at least you know you've taken it and it works so quickly. The injection here is a triptan injection. And I certainly know the rugby players are very fond of this because often they have to take it just as a rugby match is starting, and it works immediately and it gives them relief for the whole time. As we said before, avoid morphine, opiate-based tablets, and these opiate-based tablets include sulfidine, Tylex, and injections. Now, what if the pain is really bad and you think you need an injection? Well, I would suggest a suppository. And these are the suppositories here. The diclofenac 100 milligrams is very good, and it works really well, and it's used in lots of hospitals. You could have it at home on the ready just in case you got a bad headache. And as I said before, consider the preventative if you're needing these pretty often. So if migraine symptoms occur on 6 to 8 days per month, or the symptoms are of a moderate intensity. But you know, if I had migraine 4 days a month, I think I'd be trying something different. Or if you have a poor response to acute medication, you might need to consider preventative treatments. So here we talk about diaries. Diaries are so important. And they do help you as well as your doctor to assess your response to medication. The Migraine Association have been to the fore in this, and they've had produced several diaries over their long years. And this one, it's to the point and it's relevant. We really need to score the pain, give the symptoms, and write down the medication. And while you mightn't feel like doing it immediately when you have the headache, you really should visit it on a daily basis, because really it's so easy to forget what you've taken because the headache just bamboozles you. And your phone app, Migraine Buddy, proves very popular with the young people. And they come back and they tell me, oh, I've learned lots, doctor, from the Migraine Buddy. And all of a sudden I wonder, did I teach them anything? But I do find it's very useful for them. But all too often, this is all I get when I ask for the migraine diary. And it is disappointing and it's difficult because I can't advise people sometimes. Other people do their diary a little bit differently. And this lady, she had come in and she really was miserable with her migraine, and her husband was with her. And it took us a whole year to realize that she was one of those people with a pure menstrual migraine. But it was only when she took lifestyle advice and eliminated the other migraines that we could clearly see that she had pure menstrual migraine. Another option for acute therapy is this device that you put on your head, because not everybody can take medication. And, you know, it's proving quite effective. It can be used as an acute therapy or as a preventative therapy. There's a nerve here, you can see with the pointer where I'm pointing, that's the greater occipital nerve. And in a lot of people who've migraine, it's very tender. So if this area is very tender, it may be possible to get an injection there. And GPs or neurologists will usually do the injection. It can work quite well, and it numbs this nerve, and it can come into effect within 15 minutes. It's sometimes used in Beaumont casualty. Its effects vary a lot, and it is preferable if it's only repeated 3 or 4 times in the lifetime of the person with migraine, as it can cause fat necrosis and other difficulties there. I always like to keep in mind our colleague, Dr. Ray Forbes, and he's really conscious of migraine on a budget. You can access his information on the website. He recommends to stop the triptans and the non-steroidals, keep hydrated, perform regular head and neck and shoulder massage, exercise regularly. So the exercise is really cheap. The relaxation techniques, maybe having a tape at home, and use the commoner drugs like aspirin, ibuprofen, or paracetamol. Another resource I have found very useful is the World Migraine Summit. And there you recently had this lovely young lady telling us, once I gave lifestyle modifications a chance, I started to improve. And she really had to just do absolutely everything about her diet and about going to bed early. And in particular, she really had to be careful to exclude the E additives from her diet. So I'd just like to finish by thanking the Migraine Association for this opportunity to talk to you all. And if you have any queries or questions, I'll be happy to take them.